So the diagnosis of peripheral arterial disease starts with the clinical exam. It also starts with examining the signs and symptoms that a patient presents with. However, we do have tests, clinical tests that can help us make the diagnosis. One of the most commonly used tests is the ankle brachial index. The ankle brachial index is basically when you compare the blood pressure between the upper arm and the lower leg. If there's a blood pressure difference, then peripheral arterial disease may be present. A variation of this test is the toe brachial index, which compares the blood pressure in the upper arm to that of the toe. That is useful in diabetics that have very poor blood flow to their foot. One of the most commonly used tests is also the ultrasound. I actually like this test a lot because the ultrasound has the ability to see the vessels itself and allows you to understand the anatomy, whereas the ABI and the TBI are more physiologic tests. The ultrasound is more of an anatomic test. Another anatomic test that you can use is the CTA, where a technologist injects some dye into the veins in your arm, and you go into a CT machine where you take several pictures to examine where the blockage is in the arteries. And one final test, which is more invasive and is typically done by a person like myself, is when we go into the artery itself, the actual culprit artery, and we inject some dye to see the blockage. If we see a blockage, we can actually fix it then and there. That's actually the job of an interventional radiologist.